a topic that many people rarely talk about, and we will give you reasons why this is important to have this talk. Tuberculosis. So March the 24th was the World Tuberculosis Day, which was designed to build public awareness that Tuberculosis Day remains an epidemic in much of the world, causing the deaths of nearly 1.5 million people each year, mostly in developing countries. We will also be looking at TB survey findings in studio with Dr. Enos Masini, who are joining me now. He is the head of the National TB and Leprosy and Lung Disease Program. Thank you very much for coming in. We also have Evelyn Kibuchi, who is the Chief National Coordinator, the Stop TB Partnership in Kenya. Thank you so much for coming in. And this year, while marking this day, we had a lot of exciting revelations. I could say exciting, I could say it's a milestone. But let's just start with what we are focusing in this year as we marked the World TB Day. I'll start with you.
Yeah, thank you very much. World TB Day this year, it was an exciting day because we released the outcome of the TB prevalence survey that has been conducted for the past 2 years,
Yes.
which has exciting, I would say, outcomes
Yes.
that tell us that we have actually more TB cases than we had previously anticipated.
What exactly? Let's just take us through the bits of the survey that you think are very important and we should rely on going forward as a country.
Thank you very much. TB is a disease of great importance to this country. One, it's the fourth largest cause of death in this country.
Yeah.
Then secondly, in 2015, over 80,000 Kenyans fell sick and were treated for tuberculosis in Kenya. So we conducted the survey to be able to find out the actual burden of the disease. Though we are treating people, we still suspect that there are thousands others who are in the community who remain untreated or undiagnosed and treated and contribute to the spread of the disease. So we sought out by going out to the community and doing screening of close to 63,000 Kenyans and to find out what is the exact burden for tuberculosis in this country. And the results showed that close to 40% of the people who fall sick for tuberculosis every year are not detected, nor are they put on treatment. So for example, in 2015, we treated 82,000 people.
Yeah.
But it was estimated that 138, close to 140,000 Kenyans actually fell sick to tuberculosis.
Yes.
The importance of these people who are not detected and treated, otherwise called missing TB cases, is that they contribute to the spread of disease. They spread it to their children, to their loved ones, the people they interact with at work, at school, in public transport system. And the key to ending the disease is about finding the people who are missing or have not been detected and put on treatment.
Yes. And there's a huge chunk of them, 40%.
40%.
The results of this particular survey, where does this place the fight against TB in this country?
Where it places is it's actually in the right spot. We are no longer now groping in the dark. One, we know what the exact burden is. We will not now use the estimate that were previously provided by the World Health Organization.
Yeah.
But secondly, we know who are the people who are most affected. We know that young men aged between 25 and 44 years are not only more affected by the disease, but they are also likely to be missed by the healthcare system. So we can have specific programming and specific measures within the community, within the healthcare system to reach out to young men. Two, we know that people in urban areas, and urban areas in this country, like for example in Nairobi, 60% of the people in urban areas are from low-income settlements. So we need to have special outreaches and special programs, both in the community and within the healthcare system, to reach out to people in poor urban settlements.
Yes.
But also from this survey, we know that we need to use certain tools for testing that we've not been using before. We've been mostly using the microscope. But now there are newer tools called the Gene Expert, a better test, which we need to increase access to. We need to put the chest X-ray and available and accessible to the people.
Yeah.
But we also need to increase health communication like we are doing now, so that people are aware that they have symptoms of the disease and they need to go to their nearest health provider to be tested. The survey found that close to over 60% of the people who have symptoms of the disease, they have coughed for more than 2 weeks, they have night sweats, they have hotness of the body, have not gone to their health provider to seek treatment. So there must be a way that we must formulate to reach out for them.
Yeah.
But also importantly, we need to work with all the partners, the civil society, former TB patients, the private sector, to be able to get everyone who has tuberculosis.
All right,
and put them on treatment.
let's just rope Evelyn into the conversation. He's mentioned something very important about 60% have the symptoms, but they don't go to get themselves tested. Are we now going back to focus on the awareness campaigns of TB?
Yeah, what that means is that we have so many people walking in the streets with the TB disease. Some of them are not aware that they're actually having the disease. Some are aware, but they have not sought treatment. So what that means is that we have to expand the programs for creating awareness for TB across the entire population in the country. We need to loop in every other sector that has a responsibility in bringing the cases of TB down. For example, we need to bring in the Ministry of Education, because the schools could be harboring quite a big fraction of the TB cases that are not yet detected, like I said. We need to look in the Ministry of Transport. We are likely to get so many people again there who have the TB disease, but they've not sought treatment. And like he said, the highest population of the people who are affected are actually men. So we need to create more awareness in areas where we're likely to find men. For example, the sports arena, we're likely to find men there. The transport industry. Let's look at areas where we're likely to get more men. We also need to put in more effort in funding, because when you have realized that you have about 40% of the cases not detected, then we need to double the investments in TB. And therefore, to be my call to the government that this is a high time that we need to increase the funding to the TB program. This is a high time we need to call on the donors to increase their funding if you have to bring these cases down. And you're working towards a target. World Health Organization 2015 came up with a new target of working towards ending TB globally. And Kenya adopted that target of actually wanting to end TB by 2030. And so if we have to achieve that target, then it means more investment. And the private sector, there's so much they can do. For example, if you look at the telecommunication sector, they can do a lot in creating awareness through maybe the text messages in
Given that almost everyone has a phone nowadays.
Exactly, yeah. So if you look at the Ministry of Agriculture, he has talked about nutrition. We need to provide nutrition to those who are already sick so that they can get treated faster. So everybody has a role to play in TB, in bringing TB cases down.
So what are we saying? Before then, before now, and before this survey, we were working in isolation. Not every other ministry that was important to this cause was involved?
Yes, I must first appreciate the government's effort, because before the survey, they have really put a lot, the government has really put a lot in ensuring that we have the right infrastructure. We have the health centers, we have the treatment provided for free by the government. We have the diagnostics, though we still have a gap. But we must admit that so many other sectors had not been looped in, because we actually did not know that this is there. It was the size of the burden. But now that we know what we are dealing with, we know the magnitude. And we have done an analysis, like the Stop TB Partnership, and realized that there's so much that the private sector, for example, can do. Then we are calling out for increased engagement for all the sectors, including the civil society, the private sector, and even the government increasing their funding.
Yes. Masini, Dr. Masini, the focus this year as well is on stigma, and we're also going back to the areas that have seen to be marginalized or sidelined in the country. With this percentage of people who have the symptoms, they are aware that they might actually be harboring TB, but they don't go for a screening. Apart from stigma, what would you peg on this percentage of people who are aware that they are sick, but they won't just go?
In the survey, we asked some of the reasons why they don't go for treatment. And majority of them say this, they thought the symptoms were not serious enough to warrant seeking care. But I agree with you that stigma would play a key role in providing that, in being a barrier to access to treatment. And we need to work on stigma reduction program. We need to work with former TB patients. We need to work with civil society to be able to reduce stigma that's providing a barrier to access. But look at it this way. For a long time, there's been a very close association between HIV and tuberculosis. 10 years ago, close to 70% of the people who fell sick for tuberculosis in this country had underlying HIV infection. But investments that have been done by the Ministry of Health and partners in HIV care, increasing the number of people who are put on antiretroviral drugs, the drugs for HIV, has ensured that from the survey is only 15%, about 15% of all the people who have found the disease are HIV co-infected. So that message can also help to work and to show first interventions in HIV control have worked well, and that we need to look for TB amongst people who previously probably were not thought to be at risk of disease. But also to add on the point that she raised about involving several stakeholders, and in which you asked why has it been just a medical intervention? And that's the argument that is going on globally, and it's gaining currency. And it's one of the recommendations that has been in the survey, that control of tuberculosis will have to look at many other factors just beyond the health interventions. We have to look at all these other sectors that deal with poverty reduction, that will deal with improved housing. So generally, improved economic well-being has a knock-on effect in reducing tuberculosis. And that's why I would laud the ongoing government efforts to reduce poverty, to improve housing. All that will eventually contribute and assist the health sector to reduce the levels of TB.
Do you think we're on the right track?
Yes, with the new survey results, we know where the disease is, which people are affected. We know which tools or which arsenal to use to fight the disease. We know which strategies to apply. In my view, that we will still be on course to achieve the global targets of 2035 of ending tuberculosis. So it's still within reach, but we have to apply those measures that were indicated in the survey. The good thing is that when we were disseminating these results, and in the Cabinet Secretary for Health in his speech actually outlined the measures the Ministry of Health will put in place to be able to ensure that we are on target in achieving the aims we need for ending tuberculosis.
But of course, even as we talk about the strategies that you're now putting in place thanks to this survey, I'm sure there are some challenges that are still dogging this fight against TB. What are they?
I think the biggest challenge that we have is the general lack of awareness that you have all these symptoms, you have this cough, you have this night sweat, but probably you don't know that you could be suffering from TB. So you take so long from seeking, before you seek treatment. That means that before you seek treatment, you have infected maybe 1 or 2 people. And the longer you wait, there's a likelihood that you can die from the disease. So lack of awareness is a big challenge. Of course, the other one is stigma, because of the close association between TB and HIV. So people are afraid that once they go to hospital, they're going to be diagnosed that they have HIV. But the good message is, like you say, the highest percentage of the people who were found with TB did not have HIV. And the second hope is, even if you have both infections, TB is treatable, and HIV, with treatment, you can live with it. And the last challenge is that one of funding. The National TB Program has been operating with a huge funding gap. And I think with the new finding, then I think we now have confidence and we know what we are dealing with. Even when we are telling the government we need more funding, we know exactly how much we need more to address the current gaps in TB.
All right. Finally, final comments. What do we expect going forward now, say this year or the next year before the next World TB Day? What do we expect to see? Some of the interventions.
So basically all of us have a role to play. For the public, we need, if we have any of the symptoms related to TB, you've coughed for more than 1 week, you're sweating a lot at night, hotness of the body, go to your nearest health provider to be tested and screened for tuberculosis. For the Ministry of Health, we'll ensure that there's availability of the test kits and the treatment that's required at no cost, as has always been.
Yeah.
For the partners that we work with, we need to work together to ensure increased access to these interventions, drugs, testing for TB. For the civil society and the TB patients, we also have a key role to play in increasing public health awareness, in conducting community-level activities. A big focus should be on community-level activities to be able to bring out the people who have the symptoms to come for testing at the health facility.
So this time it's going to be a holistic exercise. Everyone is involved.
I totally agree. And then, of course, as we've discussed, looking at the other factors that contribute to tuberculosis, poverty reduction, improved in housing. So as the standard of living improves, then also we will be able to reduce the burden of tuberculosis.
All right,
so,
thank you.
So it's all of us in
Yes.
it.
All right, thank you so much for joining us, Dr. Enos Masini, Head of National TB, Leprosy and Lung Disease Program, as well as Evelyn Kibuchi, Chief National Coordinator of the Stop TB Partnership here in the country. Thank you so much for coming in. Very informative session. This one has been. Get yourself tested, get yourself screened. It will save a life. All right.